I injured myself most recently at the World Games in 2012. I was sparring in a match, and after doing a kick, I landed on the opponent's toe and my knee slipped laterally. And immediately I went down, knowing that I blew my ACL on my right leg this time after having 2 surgeries on my left.
Nikki's a very high-level athlete, as you know, and she needed a stable knee. And the issue with ACL injuries is that they don't heal very well, and that's why she required her initial surgery. But unfortunately, she retore her knee ACL, and her knee was unstable. In order for her to compete at a high level, she needs to have a stable knee. And so I told Nikki that unfortunately we would have to go back into her knee and reconstruct it.
So immediately I went to Dr. A to get help at Commonwealth Orthopedics, because he did such a great job on my other leg that I knew he would be able to get me back in the ring.
I recommend, typically for very young, healthy athletes who've had an ACL injury, to use their own tissue, because it's their own tissue, and the quality of the tissue typically obviously is excellent. There's less concerns about infection, and there's less concerns about graft failure. The concern with cadaver tissue is that it may take longer to incorporate. You may have to wait longer to allow them to be very active. Some surgeons use cadaver tissue as their primary graft, and they rehab the patients appropriately, and some patients do very well. The concern is for the young patient under the age of 25 that you take that risk that that graft may not heal quickly enough for them, and it may fail prematurely. So in Nikki's case, since she had been done previously with cadaver tissue, I told her that this time around we should revise her with her own tissue, and she agreed.
It was actually a pretty smooth process getting back to competition, because I finally listened to Dr. Aguiar like he wanted me to. I took about 4 to 6 months to start training again, and then bit by bit he got me closer and closer to a ring so that I can compete 8 months out of surgery.
She did great. Nikki, as I mentioned, is a very high-level, world-class martial arts athlete, and she did not miss a beat. She just sprung back to her rehab. She did everything she was supposed to. I told her to be very careful, because obviously this was her second surgery. But she listened. She met every benchmark and exceeded every benchmark, and we progressed her without any delay. Because after surgery of this nature, ACL surgery, patients start therapy right away. The night of surgery, they're doing their exercises. And typically a motion machine is sent to the house, and range of motion exercises are started immediately. She was allowed to bear weight fully, and she was allowed to proceed with formal therapy 2 to 3 times a week, starting the following week after surgery.
I did physical therapy for about 15 weeks. It was a rolling process.
Eventually, once you regain your flexibility and the swelling is gone, she's allowed to start running, and from running start to jump, and from jumping really doing strengthening exercises to progress. And these phases definitely take quite a few months, but typically at 2 months most patients have their full motion, if not sooner. And typically we're allowing them to run at anywhere from 3 to 4 months, depending on how well they're recovering.
At Commonwealth, I had a wonderful experience. Everyone there was very professional. They're very easy to work with. They're very on top of explaining any little question I had, and I'm full of them. After having the successful surgeries and being back 100%, I will continue my competitions, and I plan on competing in the World Games next year in 2014, and it should either be in Prague or actually on a cruise ship. Commonwealth Orthopedics is an amazing facility. They were able to get me back to my normal self even after having 3 knee surgeries through them. I'm just as strong as I was prior to, and I can't even say enough there. It's a godsend.